Hi friends, I am Pratap Singh Rathod. I have done the MD in Forensic Medicine. Today we'll start with new topic that is virginity. Virgin is a female who has not experienced a sexual intercourse. So by definition, a virgin is a female who has not experienced a sexual intercourse, and act of depriving a woman of her virginity is called as a defloration. The question of virginity arises and defloration arises in situation like case of marriage, nullity of marriage, where a couple has filed a case of divorce or claiming to be an null and void marriage if there is no sexual intercourse. In that cases, a woman may be examined for case of virginity. In that cases, defamation cases where a woman may file a case against a person claiming to be had a sexual relationship. Case of rape where again woman case may be there where woman may be claimed to be have been sexual assaulted in case of rape. Though nowadays the rape definition is modified, now it is not be applicable, but it is still present. In these cases, question of virginity may arise. To know the virginity, there are different signs which can look forward to. Can be divided into genital and extragenital findings. To understand genital findings, first we have to understand the female reproductive system anatomy. Mainly we have to see the conditions of mainly consist of vulva. So this part is mainly the vulva part, which consists of labia majora and labia minora. Labia majora uh, uh, converged in the anterior into mons pubis and to anterior commissure and posterior to form a posterior commissure. Labia minora, which consists of a pinkish folds and encloses the clitoris in anteriorly uh, and posteriorly for forms a posterior commissure and a fourchette, and between fourchette and the vagina or vagina is the nova fossa navicularis. So a vestibule mainly consists of clitoris, labia majora and posterior fissure. So this is the part which is called as a vestibule, and the vagina is mainly the path between the vestibule into the up to the cervix. So these are the main parts which has to be looked forward in case to understand the genital signs of virginity. So in labia majora, in virgin cases, they are mainly firm, elastic, rounded, and lie in close contact with each other, even on full abduction of the thighs. Whereas labia minora, they are soft, elastic, small, pinkish in color, and they also lie in close contact, being completely covered by labia majora. So in virgins, they are completely covered and closely approximate each other. Vestibule, as I mentioned, is a path between the clitoris and the posterior commissure. It is usually narrow since both the labia minora and majora and minora approximate each other. Posterior commissure and fourchette. So posterior commissure, which is formed by labia majora, and the fourchette, which is formed by the labia minora, are intact and crescent shaped. So this part usually gets obliterated or it cannot be differentiated in case of who has sex deflorated woman. Vagina, which is mainly the path, is narrow and tight with raised pinkish walls. There is a slit-like orifice due to opposition of the walls and presence of hymen. So hymen is the part mainly looked forward in case of a virgin, which is intact and may admit hardly one finger in the adult. So hymen is the part which obstructs the path between the vestibule and the vagina. Extragenital signs in case of virgin mainly are the seen in case of if the woman has been pregnant. So if only in case of in pregnant cases, these changes can be appreciated. Like in virgin, the breast will be hemispherical, firm and plump elastic, but after she has experienced sexual intercourse and has a delivery, it loses its elasticity. Nipples are usually small and usually surrounded by small areola, pinkish and in fair skin, while dark brownish in dark skinned girls. But usually in cases as if the pregnancy has occurred, this again they are increasing the size and they color changes are seen. Now coming to hymen, which is the primary sign which is looked for the in case of virginity to understand if the woman is virgin or not. So hymen is a fold of mucous membrane about 1 millimeter thick situated in the vaginal outlet. So it is part between the vestibule, that is part formed by the clitoris and between the posterior commissure, and the vaginal orifice is the hymen part. It is situated about vaginal outlet. It is usually thin transparent membrane, but it may be tough, fleshy and cartilaginous. In infant, a small swab can be passed through its hymen where it passes into the vagina. At 10 years of age, it tip of the small finger at puberty, and at one finger may be passed into the vagina at puberty. So mainly the hymen is intact in case of virgins, and it may becomes obliterated in case of deflorated woman. So different types of hymens are there based on the shapes. It may be annular where the opening is present centrally, or semilunar or crescent shaped where it is placed anteriorly or posteriorly. So it can be placed anterior or posteriorly where semilunar shape. Infantile where a small linear opening is present in the middle. It can be septate where two openings are present separated by thin hymenal tissue. It may be cribriform where there is multiple small openings are present. It may be vertical where the opening is in vertical, or imperfect where there is no opening at all. So this is seen in very rare cases where hymen is not it is completely obliterates and there is no opening but at all, and it is completely very thick. In that cases, many times surgical intervention is required. Now coming to cause of rupture of hymen. So first and foremost is section intercourse. So ruptured hymen is one of the primary sign of virginity, which is considered as a primary sign of virginity, though it is not totally true. So in case of sexual intercourse only, it becomes completely a commonest cause of defloration is the ruptured hymen. In case of masturbation, especially with some if foreign body is inserted, in that cases also hymen is ruptured. In any accidental like fall on the projecting substance or by slipping on the furniture or fence can cause the rupture of hymen. In some situations, many times it is a false interpretation that hymen get ruptured during jumping, riding, or vigorous exercises or dancing. So though it is not true. So in this case situation, it doesn't rupture. It is also get ruptured in case of gynecological examination or surgical operation or any foreign body insertion or use of sanitary tampons. So if sanitary tampons are inserted in that case also, hymens get ruptured. Coming to molecular aspects of ruptured hymen. So presence of intact hymen is presumptions, but it is not absolute proof of virginity. So it is assumed that if the hymen is intact, that woman is a virgin, and if it is ruptured, then she is deflorated woman. But it is only presumptive evidence. It is not a confirmatory and is not absolute proof of virginity. Since hymen may get ruptured in many other situations other than sexual intercourse, and there are also some cases of false virginity where hymen though is intact, but she has already experienced sexual intercourse. So with intact hymen, there can be true and false virgins are present. The feature will be same for definite women and the false virgins with the exception of presence of hymen in the later. After the birth of the child, hymen is completely lost and remnants are represented by the catrice nodules of varying size called the calico hymenalis or multiformis. So only after giving birth, the hymen is completely obliterated by and it is usually replaced by nodules. Now about molecular aspects of virginity. So principal sign of virginity is mainly that is the intact hymen should be present. There should be normal condition of fourchette and posterior commissure. So posterior commissure is the part where labia minora gets approximated in the posteriorly, and labia majora forms posterior forms a posterior commissure, and labia minora also posterior forms a fourchette. So between this fourchette, this is the part where it gets obliterated. Normally, if it is present, it can be appreciated, and after normal sexual intercourse, this part is becomes it cannot be differentiated. Labia majora and minora is completely posterior commission of fourchette cannot be differentiated after sexual intercourse. And narrow vagina with rugous walls is commonly seen in case of virgin, but it is absent in deflorated woman. Now coming to a few points about defloration. Defloration is also it signifies the loss of virginity. The signs of defloration includes ruptured hymen, so which is a singular most important sign of defloration. Then labia majora doesn't oppose it. There is a opening is present. Again, the minora is also doesn't covered. There is a protruding between labia majora. Vaginal canal is dilated with loss of rugosity. Posterior commissure is usually ruptured. That is the part where it is and labia majora is approximated posteriorly, which is ruptured. Breast is enlarged and flabby if the woman has become pregnant, Also, the nipple becomes large and surrounded by wider areola again in case of if the woman has become pregnant. Molecular importance, as I mentioned in intact hymen, the diagnosis of virginity is difficult and in many cases physical examination of genital organs may not be is not objective and helpful. And the presence of unruptured hymen is often presumptuous of virginity, but it's not a absolute proof. The false virgin may claim that she is a true virgin since there is an intact hymen is present. The hymen very rarely is absent congenitally, so it's not completely a sign of virginity of intact hymen or not. So we have to know the signs of true virginity and false virginity. So in case of true virgin, woman has not experienced sexual intercourse. To false virgin is a woman who has experienced sexual intercourse but has intact hymen. So hymen in true virgin is mainly intact, rigid, inelastic, but it becomes loose and elastic in case of false virgins. Majora and minora are thickish and approximate each other. And in false virgin they do not approximate each other and they mainly have loose. And vagina is narrow, marked rugosity of wall is present. There is a full length of finger can be admitted in true virgin, but false virgin is capacious, rugae less obvious, full length can be admitted. Fossa navicalis, which is present between the fourchette and the vestibule, is a depression which is present. It is present, which can be seen in case of true virgin. It disappears in the false virgin. Fourchette is intact, but it becomes torn or may show negligent scar. Clitoris is small, it is enlarged in false virgins. Posticum is intact and it may be torn. So, and vestibule is narrow, but it's gaping or wide spacious. Vestibule, that is mainly the part between the clitoris and the posticum, which is narrow and it is gaping in false virgins. So, these are genital signs. Extragenital signs, mainly if the woman is become pregnant, like if the pregnancy which can be seen in the breast changes. Usually there are small hemispherical pinkish areola and small pink in color nipple is seen in true virgins, but it becomes pendulous, flabby, pigmented in case of false virgins. These are my references. Thank you.